Hello everybody and welcome to our podcast in the NPR International. Today we talk about some very special regarding with T.M.P, tempo disorders, that is tinnitus. Sometimes we don't know what it is and what happened and if it is related or not with temporomandibular disorders. You will see in that podcast something special regarding the tinnitus and T.M.P, and not only with T.M.P, because it's also connected with another things in our body. Don't miss this podcast, and it's very interesting for all of you. Okay, we go ahead with our podcast. First, we will say what is tinnitus. It's a medical term used to describe the perception of sound in the ears when there is not external sound sources, and that's very important thing. We feel something in our ear, but there is not external sound. That is the main things we have to understand by tinnitus. Tinnitus can be temporary or chronic and may be ranged in severity forms mildly and annoying to severely disruptive. Here, some of the definitions and explanation of tinnitus. Pay attention, because that I think is very important. Some people, some patients make the definition as auditory perceptions, like as tinnitus is the auditory perception of sound in the absence of or any external stimuli, often described as a sensation of noises originating without hear nothing. Some patients said, I have a ringing in my ears. Tinnitus is like a ring in my ears. It's a subjective sensation. That's a sensation that I hear something, but it's nothing external. Right? It's like a phantom sound. It can be chronic or temporary. It can be during the whole day or just in one moment. It's like some patients say, I feel like a pitch, a pitch in my ears. And that is the main definition of the patients to us. And the tinnitus have different causes. But we here are talking about something special with T.M.P, because tinnitus can be for something about the age, degeneration in our body also can bring tinnitus. Some problems, particular problems in the ears, can make tinnitus, but T.M.P is associated with tinnitus. You don't know that, and I will try to explain you why. So what happened? I have to try to explain in a very simple way. I will try to associate different causes, just to make the differentiation between the T.M.Js. Tinnitus is associated as the age, as I saw before, earwax who block the ears, some ear infection, some medications, hypertension, vascular disorders, head and neck injuries, and Meniere disease, neurological conditions, stress and anxiety, and also excessive alcohol and caffeine. But also we have the temporomandibular disorders. That means problems with the temporomandibular joint. Jaw is connected with the skull and sometimes is cause of the tinnitus. I'll try to explain how that happened. Mainly the position of the jaw, because if you follow our channel, you know very well that the jaw position is the cause of a lot of problems in our body. The jaw position also is connected with tinnitus. And why? TMJs is nearly connected with the ears. The retro position of the jaw, that means when the jaw is back, and also, as you remember in our podcast, I talk about the vertical dimension also. A vertical dimension creates also compression to the auditive channel. That situation is creating compression and is cause also of TMD and also tinnitus. Imagine the connection. But do you see, always jaw position is related with the problem. But we carry on. If you understand and you remember that the jaw position is back, or any changes of the jaw position is creating bruxisms. Bruxisms create muscle hyperactivities. Muscle hyperactivities is creating also block in the cervical spine. Mainly, sometimes retroposition is creating block in the first and second vertebra. And in that area, we have circulation. We have some arteries that are connected also with the ear, and it's making less circulation. That increase also the tinnitus. Imagine jaw position affecting the ears, affecting the neck, and is connected also with the tinnitus. Imagine what important is our temporomandibular joint, but not isolated, because the changes of the position sometimes is related with postural disease, with occlusion, with different things. And remember always, that situation we can prevent in early age, during the growth. And please don't look only the teeth. Main situation is the jaw position. This is secondary because this obviously they block the jaw, but they don't found the jaw position. That's why we, in our school, we said, first, centrate the jaw, centrate the body, then build the occlusion, a good functional occlusion. That is important, and that is important you understand for your health. That is important for dentists, for medical doctors, for physiotherapists, for osteopaths, and mainly for patients. I'm in a lot of groups of patients who suffer temporomandibular disorders. Listen the comments. I'm suffering for them because, in my opinion, they are not well guided into the diagnosis and therapy. Why? Because in the dental schools and the universities, they don't teach the connection of the whole body. They teach just teeth. They teach just function of the TMJs, actions, etc., etc., physiology of the TMJ. But the physiology of the TMJ is related with the cranium, it's related with the body. And that's why I insist the whole therapies, not just TMJ. Whole therapy can have to be study, observes, investigate, not local only, but the whole body, 360 degrees, the whole body. That we call that holistic diagnosis. And the therapy can be holistic therapy, but also interdisciplinary therapy. I hope you enjoy this podcast. If you enjoy it, do a like. That helps to make the diffusion of this video for everybody. That helps also to grow our channel. Our channel is a free channel, and that stimulates me to do more and more videos for everybody. And we don't ask any subscription, nothing. We ask only a like if you like it. Subscription for free subscription, no money. Free subscription for the channel, the bell, and that's it, no more. That will help a lot for everybody to make a diffusion of this concept. If you like it, do a like, do a gift for the channel. See you in the next podcast, and I hope you enjoy our podcast in our, remember, NPR International channel. See you next. Bye bye everybody.